This is Dr Lodhi, MD. I'm a rheumatologist. I practice in Osceola County. I specialize in autoimmune condition. Today we're going to discuss about systemic lupus erythematosus, which is also commonly known as lupus. It's an autoimmune condition, meaning your person's immune system attacks their own body. We do not know the reason why the immune system behaves like that. But depending upon the severity of the condition, some people could have a mild condition, some may have a severe condition, and also in certain cases it can affect the organs, which we normally see in severe patients. So the patients who present with lupus or who are suspicious of lupus, they present with certain signs and symptoms. So the symptoms we'll discuss first. Lupus can affect anywhere from head to toe. So depending upon the area of involvement and the organ involved, patient will experience different symptoms. For example, patient who have a involvement of the brain, they will have anxiety, depression, seizures, but not everybody have the same symptoms depending upon the severity. And the patients where lupus affects the heart and lungs, they can present with shortness of breath, chest pain, and difficulty breathing, and sometimes they can have some, in severe cases, have a persistent cough, and in very severe conditions, they may have some blood coming out in the sputum. And the patients who have experience with stomach issues, the lupus can affect the stomach and the intestine area. Those patients tend to present with nausea, vomiting. Most commonly, these patients with lupus present with joint pains affecting the joints, and they tend to be very stiff in the morning. And they also can develop rashes of the part of the skin which is exposed to the sun, like face and hands, forearms, or depending upon which area of the skin is exposed, stomach and the back also. And lupus can also affect the kidneys, and in that case patient will have a blood in the urine, and in those patients the patient could just have a simple kidney disease or could also have rest of her other organs involved. So depending upon the severity, we have different classification, or how we describe the lupus of the kidneys, because it has different stages. Some may have mild, some may have severe. So all these organs involvement varies from person to person. Some may have a mild condition, some may have a very severe. And so the sign when the patient comes to the physician, then the physician examines the patient and they see certain signs. Most commonly, if the skin is involved, patient would have a rash, especially on the face or the part of the skin, and part of the skin which is exposed to the sun. Lupus rash usually never occurs on the part of the skin which is not exposed to the sun. This has something to do with ultraviolet light exposure to the skin. Sometimes patients who don't go out in the sun, they can also have the same phenomena if they sit or stand very close to any light source which has ultraviolet light. Also, patient will be also have mouth sores, and that can be have multiple sores or maybe few, but they come and goes. And then depending upon the organ involvement, then there are particular signs which we as a physician see in different patients, especially the joint swelling if their joints are involved, and they could have a edema of the ankles, like the ankle swelling due to internal organ damage. So lupus, depending upon the severity and the area of the involvement of the body, lupus can be treated in different ways. I will go over just the overview of the different treatment options, but actual treatment depends on what part of the body is involved and how severe the condition is. But in general, patients who have a lot of joint pains, we start with a low dose steroids like prednisone, and then we'll add hydroxychloroquine, also called as Plaquenil. And we see good results with these combinations, and after a few months we taper down the prednisone and maintain hydroxychloroquine. Then depending upon if there are other organs involvement like brain, the heart, the lungs, the kidneys, then we use more strong treatment options like azathioprine, mycophenolate, Cytoxan, and sometimes these medications are given through IV depending upon the severity of the condition. But the majority of the patients do respond to the moderate treatment. Very rarely we have to go very high doses or we try to be very aggressive. So in summary, whenever you suspect any of these signs and symptoms that I mentioned, please talk to your primary care physician. They will evaluate you and order proper tests. Most commonly they order ANA. And while we're still waiting on the treatment, I strongly advise lupus patients to avoid sun exposures or any ultraviolet light exposure. Use vitamin D supplements, and if you have to go in the sun, please use sunblock, at least SPF 50 or more. And you have to keep using it after about every hour or so. Just because you put one time, that doesn't mean it's good for the whole day. So please talk to your doctor, and if you have any specific question, they will be answer you. And if they really suspect that you have lupus, then they will refer you to a rheumatologist.